Hello students, welcome back to our channel. This is Panchakshari. In this video I am going to explain about the next concept of the anesthesia and OT techniques. The main concept comes under the anesthesia and OT techniques. The first, pre-operative assessments. Pre-operative assessments, you know the pre-operative assessments. What are the assessments you done in the pre-operatively? Before patient going to the surgery, you have to do some analysis, evaluations, and about the surgery and study about the patient condition and patient investigations. All these are come under the pre-operative assessment. What are the pre-operative assessments? Pre-operative assessments, not these are investigations and not only with the procedure explanation. It's all consider about the particular goals. What are these goals? What are the goals? The first goal is reduce anxiety and educate the patient about anesthesia. First thing, goals. What are the pre-assessment goals? Pre-assessment goals. Before surgery, you have to assess the patient. What are the main goals of pre-operative assessment? It is to reduce anxiety and educate the patient about the anesthesia. First, you have to go the patient side and talk with the patient, and you have to be reduce their anxiety. And talk with calmly and then give a positive openness and reduce the anxiety about the surgery and further procedures. You have to reduce the anxiety and educate the patient about the anesthesia. Educate the patient about the anesthesia and particular procedure. And you should educate the patient. You have to be give a complete information about the anesthesia, like what will, and first one is reduce anxiety and educate the patient about the anesthesia. This is the first goal of the pre-operative assessment. Second one is to obtain the information about the patient history. To obtain the information about the patient history. Once you done the pre-operative assessment, you will know about the patient history, what are before the past and present illness of the patient. And you will get to know the all the history of the patient condition. Next, second one is to obtain information about the patient history. Third one is to perform physical examination. What is the third role of pre-operative assessment? To perform physical examination. You have to perform physical examination. Physical examination should be done before only surgery. Okay. Pre-operative physical examinations to perform. Okay. It's the goal of the pre-operative assessment. And to determine the which tests are required. Pre-operatively, some of the investigation tests are required to post for the surgery. That's why you will determine the which tests are required to do surgery. Okay, before only the surgery, you have to be mentioned about the what are the tests are required and what are not. Okay, fourth one is determine the which tests are required. Fifth one, to anesthetic technique. Fifth one, to anesthetic technique. Based on the patient physical examination and other tests and investigations, you decided what are the anesthesia plan, what are the anesthesia technique which need. This is very important to anesthesia technique, to planning the anesthesia technique. Next one is to obtain informed consent. To obtain informed consent. Patient should give a consent before the surgery. Whatever the procedure you have to do, before you have to take a consent from the patient and patient attendants also. To obtain the informed consent, you will get the informed consent by the patient. To give a Pre-operative instructions. Last goal of the pre-operative assessment is to give a pre-operative instructions. Pre-operative instructions. Some of the instructions you have to be give, like don't take any oral fluids or any meal and breakfast, anything before surgery. You have to be nil by orally, like these are instructions should be given in the pre-operative assessment, and it's also planned by a pre-operative assessments only. Okay, next coming to the all these are goals of the pre-operative assessments. Next is pre-operative evaluation done with. Pre-operative evaluation done with what are the things? Pre-operative evaluations. What are the pre-operative evaluations? Before only we told about the pre-operative evaluations, like patient history, investigations. All these are come under the pre-operative evaluations. Pre-operative evaluations done with the first one is history. First you take a history from the patient. Okay, what are the things you have to be considered in the patient history? History of the medical and illness and past and present. History of the medical illness past and present means any medical illness before the 1 year back, 6 months back, 2 months back, any medical illness it is there or not, you have to be confirmed. Like if it is there, you have to be mentioned. Okay, history of the medical illness past or present, it should be a compulsory to every patient. You should be asked, patient or patient attendants, they will told about the past history about the illness and medical, any admission in the hospital, like this. Next one is history of allergic any drug. History of allergic to any drug means some patient is allergic to some drugs, like what are the drugs we are using in common generally, or it may be we are using in the anesthetic drugs. All that are causes some allergic reactions in some patients. That's why you have to be confirmed before only what are any allergic reactions in the first. Okay, next one is medication. Any history of the medication like blood pressure, hypertensive patients take a continuous BP tablets, and sugar patients and diabetic patients are taking every day controlling the diabetic oral anti-diabetic drugs. All these are come under the medication that should be a, like IHD patients, all heart disease patients are taking some like drugs that are should be give a particular points. That's why you have to be know about the all these are drugs are taking from which year, like how long it is they are taking. It should be you have to be know. Next one is history of previous anesthesia. History of previous anesthesia means before any like any histories of surgeries, any histories of anesthesia, either general anesthesia or spinal anesthesia, you have to be taken from patient. Next one is personal habits. History of the personal habits. Personal habits, present or past. You have to be take habits, personal habits like smoking, alcohol, drug abuse. All these are personal habit, like they are addicted or they are left, or it is how very considerable in the pre-operative assessment. Next one is next one is general physical examination. All these are history of the patients. History of patients conditions, like you should be asked everything. If you taking history of the patient, you should be take medical illness, allergic to any drug, and medication or previous anesthetic, any procedure done in before, personal habits. All these should be considered in the history of the patient. You should ask patients and patient parties. They will give you complete history. Next one, general physical examination. General physical examination is it is a when you look a patient, you have to be know about the what are the normal weight, what is the weight and what is the height and what is the condition of the current situation. Like a general physical examination, it is also pulse and BP and saturation. General physical examination, you go to bedside of the ward, you will know about the patient saturation, pulse and BP. They are recorded in the some chart. Like general physical examinations also done with the systemic examinations. Systemic examinations are CVC, respiratory, hepatic, nervous system, and spine. All these are all come under the systemic examinations. Systemic examinations complete hemogram, HB, and PTINR, and platelet count, and WBC count, and RBCs count. All these are come under the systemic examination. Respiratory rate and tidal volume, how much his lungs are good or not. All that are coming to the systemic examinations. Hepatic means liver function test, and nervous system means like any injuries, nerve injuries. You will know about the any fast nerve injuries, any particular symptomatic nerve diseases. You will know about the all this. And renal function test. Once you done with the renal function test, you will know about the kidney functions, how it is. And liver function test, you will know about the livers, how it works, and okay, how much it is functioning. Like this, systemic examinations comes all this comes under the systemic examination. And general physical examinations, what are the, any what is the breath holding, and what are the airway assessment. Breath holding and airway assessment. Breath holding, you have to told about the at least patient hold that breath at least 25 seconds. Okay, 20 on complete full respiration, inspiration, he has to hold 25 seconds. Less than 25, it is a mild respiratory complications, and less than 10, it is a severe respiratory complications. Like this, general physical examination should be done with a airway assessment. Airway assessment means 3-finger breath airway assessment. Its airway assessment will discuss in the difficult airway management. All these are about the general physical examination. General physical examinations also comes under the he is able to walk, he is able to run, or it is work in his own itself. It is all come under the general physical examinations. How it's talking with the, he is responding, he is obeying. All these comes under the general physical examinations. Okay, all these are pre-operative assessment, and another one is there. I will do it in next video. Thank you so much.